My talk today is about the Nipissing District Developmental Screen. How well does the Nipissing District Developmental Screen identify communication problems in infants? Oh, let's see. Yes. Delays in communications are the most prevalent symptoms in young children with developmental disabilities. Communication problems, as you might know, are an early sign of autism. With early detection, early intervention can start. The Nipissing District Developmental Screen, or in short NDDS, is a broad developmental screen. It's a parent questionnaire which has 17 items, which can be answered with yes or no. The selection of one or more no responses indicates that the child needs to be followed up for his development. It is known as the one flag rule. Formerly, there was a two flag rule, which indicates that the selection of two or more no responses needed follow-up. The NDDS is strongly encouraged by the Government of Ontario and is free in Ontario. So I have no idea about the Quebec or Montreal area, and I just want to see some hands. Which of you is familiar with the NDDS? Or some? Okay, not too many. Okay, then I will continue. So the NDDS has several developmental markers. It has an emotional area, a fine motor area, gross motor area, social area, self-help, a communication area, and learning and thinking. There are about 10 questions who are addressing the communication domain. So there has been a lot of research done already with the NDDS. And in 2004, Susan de Hinton compared it with the Baileys. The Baileys, as you might know, is usually considered as the gold standard for development in children. And that study group concluded that the NDS was able to pick up severe developmental delays, but not moderate delays. More recently, John Carney and Jean Clinton, who you met yesterday, concluded in their study that the NDDS was very good at identifying children without delay, but when used alone, it might miss children who would benefit from further assessment. So I'm going to introduce another questionnaire to you, which is more used in the United States. It's an Infant Toddler Checklist. It was originally designed to detect children with communication delay, but because the phenotype in children with developmental delays, autism delays, and language delay often overlaps, it was found in a large pediatric study that it can also detect these disorders. This questionnaire is standardized, and it has standard scores on monthly intervals from 6 to 24 months. The ITC is free, so you can download it from the internet, so that means it can be used by broad population too. It has a very high sensitivity and specificity for the detection for autism, but also for other developmental delays. This questionnaire had 3 domains: a social-emotional communication domain, a receptive and expressive communication domain, and a symbolic communication skills. So for my study, we had as main objective to assess the convergence validity. That means the degree to which the NDDS and ITC are related of the 18-month NDDS with the ITC. The second objective was to compare a similar question. How many different words does your child use on both the NDDS and the ITC? So this study was conducted in Target Kids. As Target Kids is located in Toronto, and it's a community-based child healthcare research network. And at each annual scheduled well child visits, parents are asked to answer validated questionnaires. You can have more information about this Target Kids and our information booth, and also online. So the methods for this study were we included all children from 18 to 20 months. They had to have data on both the 18 months NDDS and the IDC. We excluded children with any chronic condition, acute illness, or children who are already known with a severe developmental delay. So this table represents the results of our study. We included 348 children, and 55% were male. Our mean age was 18.5 months. We had a mean age of maternal age of 35, and you can see our population is a relatively high educated population. 94% of our mothers of this study attended college or university. So this figure demonstrates the number of flags. That means the number of questions failed on the NDDS. 60% of our population did not have any flags on the NDDS, so mothers or fathers didn't answer with any no. However, if you look at the one flag rule, almost 39.7% of our population had one flag or more. If we had used the two flag rule, 15.4% answered two or more questions with no. So I used the same scale to demonstrate the results of the ITC. You can see they are much lower, the concerns. We have 3.4% of a social concern, 8.9% of a speech concern, 5.5% of a symbolic concern, and 3.7% had a concern on the total score of the ITC. So when we compared both questionnaires together, we looked at the correlation and as a level of agreement, known as Cohen's kappa. You can see that the correlation with the two flag NDDS and the ITC was medium. And both questionnaires, when using the two flag, had a fair agreement. However, when using the one flag, which is currently recommended in Ontario, you can see the numbers are much lower, which indicate a poor level of correlation and only a very small agreement between both questionnaires. We also looked at the sensitivity and specificity of the NDDS compared with the ITC. Sensitivity meaning the proportion of children who are correctly identified with communication problems. Specificity means the identification of children who didn't have any communication problems and who were identified as such with the NDDS. You can see if we compare the total ITC concern with the two flag NDS, had actually a good sensitivity and specificity. The specificity of the NDDS using the two flag rule was in general good. However, the sensitivity for some of the domains was a bit low. If we use the one flag rule, it is a too low specificity to use actually in a clinical population. So to conclude this part of the study, the two flag NDDS and ITC have a moderate correlation and a fair agreement. Sensitivity and specificity of the NDDS versus the total score of the ITC was very good. However, there was a low sensitivity for speech and a social concern. To go further with our second objective, we compared a similar question about how many different words does your child use on both the ITC and the NDDS. This figure shows the individual questions of the 18-month NDDS. You can see question number 6 is a real outlier. 24% of the parents answered no to that question. And guess what? Question 6 is actually the question asking about the number of words. You can see on the ITC we have a similar question about how many different words does your child use meaningfully that you recognize as such. 5 children didn't speak any words. 21 children speak 1 to 3 words, and 81 children spoke 4 to 10 words. The percentage, 30.71 children who spoke less than 10 words, is pretty comparable with the NDDS, in which 24% of the parents indicate their child didn't speak 20 more words or more. So to conclude this part of the study is that I think practitioners should be very aware that the vocabulary range at 18 months is actually very wide. 14 words is the 10th percentile, and 269 words is the 90th percentile. It's the same when we check for walking. A child can walk early at 10 months, but also late at 2 years, and both can be normal. So the current recommendation of the authors to use the one flag is very, I think it could make parents worry unnecessarily. And practitioners should know when they use this questionnaire, it has actually a small correlation at low specificity values with a more extensive questionnaire like the ITC. So to conclude, children with severe communication delay can be identified with the 18 months NDDS. However, the low sensitivity in detecting speech and social concerns suggests that infants who could benefit from early interventions may not be identified. For the early identification of all communication problems, we recommend using a standardized questionnaire like the ITC. So I would like to thank my co-investigators who participated on this study, Dr. Patricia Parkin, Corey Borkhoff, Christine Korseki, and Vida Sabi. Also our Target Kids leads, Catherine Bergen and Jonathan McGuire, the whole Target research team, and to end, all participating families for their time and involvement in Target Kids. Thank you.